I'm just trying to make sure everyone is seeing this, right? So you stand on the right side and then you listen, right? So you can start with whatever order you want to start in. You want to listen to the heart first, listen to the heart first. You want to do the lungs first, do the lungs, right? What I will say though is that if you think it's chest, so it's chest pain is the complaint, at the very least, do the lung basis. Okay? Yeah, at the very least, if you don't have time to do the rest of you'll see time goes by quickly. Yeah. Okay. So you want to listen, and then you listen again to all patients take medications, right? So you're going to auscultate, start first with the diaphragm and then with the bell, right? So the diaphragm, right? They're just breathe normally, right? And then you listen, right? And then say which valve you're also listening. So I'm listening to the aortic, the pulmonic, right? Tricuspid. And can you please lift the breast for me on the left side? Yeah. And then you put the stethoscope, right? And then you listen to the mitral valve, and then do the same thing with the bell, right? So listen with the bell. Some murmurs are better heard with the bell. Okay. Okay, and then you can do auscultation of the lungs, right? Sorry?
How do you dictate that?
Yeah, just say where you're listening. Okay, so I'm listening in the second intercostal space, right and left. I'm checking for any murmurs over the aortic and the pulmonic valve. Moving on to the tricuspid and to the mitral valve in this position, no murmurs appreciated. Or you can say S1, S2, and no normal rhythm, no additional murmurs. Yeah?
And if they said there's a murmur, then we would do the maneuvers to, like if they
yes.
said like mitral, like murmur at the mitral.
Yes.
Yeah.
Maybe I'll check for radiation.
Yes. If you have time, if you have the full 8 minutes to do just the examination, do the accentuation maneuvers because you have time to do them. Okay, but like your colleague said, if you have only limited time, then if there's a murmur, that's the time to do the accentuation maneuver. Okay. What else was I going to say? Oh, about the easy way to remember which one is systolic and which one is diastolic. I learned arms parts for diastolic murmur. Maybe you've, so aortic regurgitation, mitral stenosis, pulmonary regurgitation, and tricuspid stenosis are diastolic murmurs. Okay? Yeah. Arms parts, so ARMS and then PRTS are all diastolic murmurs. So in the filling phase of the cardiac cycle, between S2 and then following S1, you'll hear the murmur in that. If it's very faint, like there's a grading from 1 to 6 for the murmurs. If it's 1 or